All right, so as you can tell, I am recording this video from my Prius because I am terrified that I will forget half of the things that just happened in that appointment. So, a couple of good things. First of all, she is not convinced that I have PCOS, which is a huge deal considering that is one of the most common causes of female infertility. So I'm really hoping that some of the blood work we're going to do will actually rule that out and help me find a different way to manage other things like my weight so that I can get some of that under control as well. Speaking of my weight, she is not convinced that that's an issue for me right now. She said that if my weight was an issue, it would be present in other things that would be causing issues for me. But since my periods are regular and some of the other cycle tracking I do shows different pieces of what happens in my cycle, she's not totally convinced that my weight is an issue. So those were some very positive things I got to walk away with today. So I was very excited about that. Couple of things from the visit. So first of all, it's not as overwhelming as I expected it to be. So for those of you that are considering going to an RE for your first appointment, or those of you that have not done it just because you are afraid of what it might look like and how overwhelming it can be, I was surprised to say that it wasn't that bad. As far as the doctor goes, it was a very laid back setting. She actually took me into her office, not into an exam room. And we talked about what I wanted from this and where I thought this would go. And we talked about what she thought I needed to do. So she outlined a couple things for me, very detailed. She wrote down a lot of notes for me to take with me, which was awesome, so I didn't have to take notes. And she explained more about what testing she wanted to do, where we thought we would end up, and how this process would look, which again was nice because then I didn't have to ask a ton of questions. So for those of you that know me and know me well, know that I had about 7 pages of questions to ask when I walked in, and I only asked 4 of those because she answered most of them without me asking. Some of you know that one of the reasons I ended up here is because my primary OB would not do some of the blood work I wanted to test for blood clotting disorders. And I was also very excited to say that this doctor jumped right on the bandwagon and said, absolutely, we need to test for these things. And there's a list of things she wants to look at in addition to that. So I was rather excited about that as well. So where do we go from here? So I am leaving today after I get done here at the office, which is now, and I am going to have an exorbitant amount of blood work done. So for those of you also who know how hard of a stick I am, that's going to be fun for the rest of the day. Dan's going to have a little bit more testing done and some blood work as well, just to make sure everything's great with him. And then once we get that blood work back, it'll determine where we can go from here. She said there's a couple things she wants to look at to make sure that there's no genetic abnormalities. Check the ovarian reserve, check my ovulation, things like that she's confident are happening, but that she wants to make sure are happening like they're supposed to. So that will help there as well. And then after that, we will determine what we need to do from there. So luckily I'm on vacation next week, and Monday I need to have a fluid ultrasound that will check for any abnormalities in the uterus for things like polyps or any types of growth, abrasions or things like that that could be causing issues. Some of those could result from my previous pregnancies that resulted in miscarriage. In addition to that, we are doing some genetic testing to make sure that there's not something wrong with me or with Dan that causes us to lose the babies, so that when I do get pregnant, it is sustainable. We talked about the cost, which, as most of you know, is my primary concern because of how expensive this can be. And she is confident that most of my testing will be covered by my insurance, since it's not actually coded as a fertility testing. It's just basic testing. She's also testing for my thyroid, which is awesome as a side note, because no one's ever tested my thyroid, and I've always wondered about that. But as far as IUI, we're looking at $1,000 per round, which is actually pretty discounted from her normal rate, which I thought was awesome. And it includes everything except for the medications, which is about $500 per cycle. If we get to in vitro, though, this is where this can get very tricky because of the genetic testing of the embryos, which is really required because of how many losses I've had. We're looking at about $20,000 a round because we have to freeze the eggs, we have to send the eggs off for genetic testing, and then we have to cycle through the eggs that sustain the genetic testing to send it back. So I'm really hoping that we don't get to that point. So for those of you that pray, please do. For those of you that just send your good Mother Nature bound juju, I'll take that too. But we're really hoping that at this point, we don't have to get to that, because as you guys know, we don't have $20,000 laying around. I know that that sounds high in comparison to other testing, and from a baseline test, she's actually very competitive with other institutions that I've researched, but from the additional testing that needs to be done because of my history is where it can get very expensive. So we're we're really hoping that we don't have to go that route. If you guys have any recommendations on things that have worked for you, or for those of you that have been to an RE and have had these types of tests done, what I should expect, or anything that you have input on, please let me know. Thanks for watching, and I will continue to keep you all updated.